prevention is better than cure. Kanyakumari District Red Cross Society, over the past nearly 6 or 7 months, has been in the vanguard, joining the frontline workers, the doctors, the paramedicals, the sub-staff, the police, even an ordinary chaprasi in the hospital, who are the people who ought to be worshipped today, revered as divine intervention in human history. And Red Cross has been in the vanguard these 7 or 8 months, right from the 17th of March, 22nd lockdown announced, from 25th till date. Every morning, 9 o'clock, great event starts of reaching out to people. COVID awareness and COVID relief work. One of the very core areas in which Red Cross Society has committed itself to is disaster response and disaster preparedness. And I am so happy that Sree, who is the coordinator of the program, is also the coordinator of the response and the disaster relief program of the Kanyakumari District Red Cross Society. And this is an ongoing program, has been going on for the 6, 7, 8 months, being able to serve more than 20,000, 30,000 people. And at the same time, even right through the thickness of the lockdown, we could organize in Government Headquarters Hospital, Takkalai, a great blood donation camp, the dire need of the moment. The Vice Chairman, the Secretary, the Coordinator, they all immediately swung into action. In keeping with the basic 7 principles of the Red Cross Society, today we have been able to do a lot of things for the affected people. As is rightly said in the inaugural address, this is a time when we should be transparent and accountable. Yesterday, there was a news that India is one of the countries. We are really sorry to read the news, which stands 153rd in the backdrop of its GDP, with 4.54% of budgetary allocation for healthcare. What a shame. The 3 things that we observed, the 3 things that we noticed, and the 3 things that we wanted to share with you. At this moment, number 1, any program, any disaster management or disaster relief program will be meaningful. We are talking about 2025 target. We are talking about 2030 target. We are talking about the current crisis that humanity has undergone of enormous proportion, perhaps unheard of in the 2 millennia of human history. It is true that there was plague. It is true that there was a cholera epidemic, but it affected only one section of the community, one section of the society, one section of the continent or a country. But not of the present scale, the entire humanity, the whole world. Perhaps I should be right if I say not the whole world, the whole universe as well. There have been people who are flying to moon, flying to the other parts of the solar system from United States and the USSR. I don't know whether they are also carrying with them the coronavirus. Such is the prodigious proportion of the great human tragedy that we have been witnessing. From our experience, this is an organization which is committed to the great dictum: to think globally, but act locally. Think globally, but act locally. If every one of the villages, if every one of the taluks, if every one of the districts becomes the right sponsoring body for carrying forward as frontline workers in the great fight against COVID-19, I'm sure that will be the greatest relief for humanity. It is true the government does have a role to play. We just don't deny. But statistics tells us the place where we are now, 153rd. with 4.54. There has not been enough flow of money into the coffer of the common man. So these are the three kinds of experience that we had as a result of our involvement, our participation in the post-COVID programs in particular, and the disaster relief and the disaster management program in general. Number one, the organizational preparedness, the organizational infrastructure. Unfortunately, what happens is there have been a lot of people who are well-meaning, want to get themselves involved. But these are the two things that they basically lack. Number one, the organizational infrastructure. And number two, preparedness. We have a good resource person in Mr. Suresh, who has been able to train contingent and contingent of volunteers, battalion and battalion of volunteers. So the moment the call comes, and this is a call that comes when you're thoroughly unprepared, and this is a call that comes when you do not expect it at all. As the Bible says, this is a call that comes in the bewitching hours of the night, almost like a thief, and you're caught unawares. Perhaps this idiom goes in English, caught with your trousers down. Not being able to know, not being able to realize what exactly is the tremendous proportion of the great work that you and I are called upon to do. So the best option for all of us, particularly those who are directly involved in the very process of the relief work and the disaster management, is to ensure at the grassroots, as Gandhi rightly said, India lives in its villages. India lives in its hamlets. India lives with every migrant worker. So this is the area that you and I were called upon to address. And fortunately, this is an area which was not addressed at all. I fully share the sentiments expressed by the great crusader who inaugurated the program today. My hats off to you, sir. Are we prepared? Do we have the resources? Is sufficient training given to our volunteers? That they are ready, that they are prepared to face any eventuality. This is number one. And number two, most of the people obviously talk about the resources. Not necessarily the human resources, the economic resources, the financial resources. But our field experience has taught us, as long as you walk into the field, with the best of intentions, people know that you are doing it, and people willingly come forward to help you. This has been the experience of the Kanyakumari district branch of the Indian Red Cross Society. With no penny in our coffer, we launched the program. It came from different quarters, unexpected quarters. We really do not know that there were so many people, well-meaning people around all of us. There was an auto rickshaw driver. Can you imagine? An auto rickshaw driver whose daughter was suffering from cancer. He contributed. Whatever little things. It was the former chief minister of Tamil Nadu, Perariya Ranna, who said, every pie to me counts, which comes from a hut and a hamlet, not from the rich. And these are the souls and these are the backbones of India. And these were the people who helped us move forward, who helped us carry the movement forward. And the third and the last thing, and with that I stop. I know that there are panelists who are going to share with us the great message of the disaster relief and the disaster management. The involvement of the community. One thing that really makes us happy is that a pandemic moment, a disaster moment, maybe a cyclone, maybe a flood, is a godsend moment for India. We cut across all man-made differences of caste, creed, religion, language, community, continent, region, that they all may be one. As John puts it, that they all may be one, that we are all together. As members of a larger humanity, the vast sea of humanity. The ancient Vedic classics called it the Vasudeha Kudumbaha. That we are all members of a larger family. It's not just Indians, it's not just Bangladeshis, it's not just Pakistanis, it's not just Europeans, it's not Americans. But all of us, whether white or black or yellow, You speak Hindi or Malayalam or Japanese or Spanish or English or whatever the language be. That we are all part of one family. The great Tamil poet Kaniyan Pungundanar, 2000 years ago, sang Yadum Ure, Yavarum Kelir. Yadum Ure, every country is my country. In the United Nations General Assembly, if you just look up, these are the words that are inscribed in gold letters as a living message for the entire humanity. Every country is my country. Every hamlet is my hamlet. Every state is my state. Yavarum Kelir. We are all friends. We are all kiths and kids. We are relatives. You are my father. You are my mother. You are my uncle. You are my aunt. You are my brother. You are my sister. You are my cousin. It's a great moment of social harmony, communal harmony, and peaceful coexistence. It is this that made a lot of people whom we did not name, who went off their ways to help the migrant people as they walked across, barefooted, carrying the 2-month baby, 3-month baby on their bosoms. So disaster, in the words of William Shakespeare, sweet are the uses of adversity. Sweet are the uses of adversity. Disaster perhaps has taught us this great language. I am so happy that today's program is organized. Number one, as a moment of introspection for all of us. And number two, to talk out our own strategies to be able to leap into the movement. It is thick and thin, fighting at any cost. Number three, tremendous faith in humanity. It was Gandhiji who once said, even if all the people who follow me desert me, I will march on single-handedly, all alone, because I still believe in the still sad music of humanity. I still believe in that humanity. It is this great moment that has taught us that humanity counts. Every man counts. Every woman counts. Every child counts. It was William Wordsworth who once said, and what man has made of man. What man has made of man. Man has made of man today that I am your friend, that I shall come to your rescue. One of the beautiful adages in English is that God receives when man is paid. God receives when man is paid. You do not have to turn to God at all. You do not have to turn to any religion. You do not have to worship God at all. You serve your fellow men. You'll be the carrier of the torch of the life of the disaster management, of the disaster relief work. There is a great God who is there in heaven to bless you all. All the movements, be it Rotary, be it the Lions Club, be it the Indian Red Cross Society, or be it any organization. I'm so happy that they are together, sharing over all of the differences. We have only one aim, and the aim is helping my friend who is my next door. I do not want to help my friend who is in the States. I do not want to help my friend who is in Chennai. I do not want to help my friend who is in Pune. Pune man will take care of Pune. I want to care for my neighbor, my immediate neighbor, the neighbor whose voice of cry and weep and wail drains through my heart. It is this man that I want to help. And it is his great moment. And therefore, on this International Disaster Risk Reduction Day, let us once again commit ourselves. Let's listen to all the expert talks that we are going to listen to and rededicate ourselves. Once again, commit ourselves for this great cause of humanity, transcending all man-made differences of even a country, nationalities, national boundaries. Let's march together. Victory is ours. Let me just stop with one quote from the great Nobel laureate, the great American fiction writer, the great novelist who wrote Old Man and the Sea, Ernest Hemingway. Man may be destroyed. It's not a sexist language. Instead of man, you substitute human, all right? Man may be destroyed. Woman may be destroyed. Look at the last line. These are the last words of Santiago, the protagonist of the novel. Man may be destroyed. A woman may be destroyed. But remember, man cannot be defeated. A woman cannot be defeated. The disastrous relief movement cannot be defeated. The great effort, the great endeavor by the vast sea of humanity will never be defeated, never be defeated, never be defeated. My appreciation to each one of you. Let's listen to all the talks. but that should serve as a menu for marching on to the field to continue to offer our work with still greater intensity, involvement, dedication, and commitment. Thank you very much for your patient hearing.
Thank you very much, sir. Thank you very much. After a very long time, we could able to hear your voice, because you also joined as a frontline warrior. From morning to evening, you were with us. You have been with us. You will be with us, working for the community. Indian Red Cross Society Kanyakumari District Branch, not only in COVID era, past 2004 tsunami, 2010 flood, 2015 flood, 2017 Ogi cyclone, and the present COVID response, Indian Red Cross Society is moving forward, getting along with the community, working for their local needs. In this August gathering, I wish to inform that Professor Dr. James R. Daniel was responsible in implementing 100% literacy in Kanyakumari district next to Kottayam. He was deputed from college to district administration, rather district collector taken over him to implement the mission of 100% Saksharata to Kanyakumari district. So he is not only an academician, he is not only a scholar, research scholar, he is not a guru alone, he teaches the unknown. So for that cause also we thank sir has given right word to our founder member NDMA Professor Vinod Menon sir, great crusader. He is a new avatar. He is a new warrior. He is a Karnava, guiding the entire nation to look forward and ensure disaster resilient India 2030. So I join hands with the Professor Vinod Menon sir and all the hosting Rotary, Red Cross and Lions fraternity. We take this opportunity to thank you very much, sir. Thanks a lot. Now, this is the time to hear from our hosting president, Rotarian Advocate Swarnalata Mahesh Madam from Rotary Club of Chennai, Bharati.
Yeah. Good evening to one and all. I've just introduced Rotarian Swarnalata Mahesh.
Please.
Rotarian Swarnalata Mahesh is our current president of Rotary Club of Chennai, Bharati, 2020-21. She did her schooling in Good Shepherd Convent, Chennai, and went on to study law at the Madras Law College, Chennai, practicing advocate from 1993 at the Madras High Court. She specialized in constitutional law, also a commercial arbitrator since 2008. She is also the trustee of an organization called PEN, stands for Protection and Empowerment of Nari. Over to you, Swarnalata Mahesh.
Thank you, Madam, Dr. Renuka Madam. President Madam, now the floor is for you.
Vanakkam. Good evening to all. Thank you for this opportunity. I'm happy to be here before all the esteemed dignitaries.
Madam, can you be a little bit louder and keep the mic close?
Thank you to all the esteemed dignitaries here. It's a pleasure to be with you all and an honor too. Disaster management, risk, governance. I think we need to even include awareness. Not many people understand the concept of disaster. They feel only when you have a big flood or a cyclone, you need to go out and reach to people. That is not the case. Even a small situation where we can help, we can do it. Anything done like this would be voluntary. I'm happy that the past people, the dignitaries before me have spoken about such enormous activities done. From my side, all I could say in Chennai is from 2015, we are suffering a lot. We had the tsunami in earlier, 2005, 2006. But now from 2015, 16, a cyclone, a flood, now the pandemic. So Chennai has witnessed all these in the last few years. Chennai has never been prepared for all these things. We've always been on the safe and comfort zone with not bothering about our neighbors too. But this pandemic, though it has created a fear in all of us, it has taught us to be one. We need to look out for each other. We need to help out to each other. It has also taught us that there is no point in hoarding. The minute it was a lockdown, a few communities, they just went and, practically bought everything what was there in the shops. They did not turn back to look and think, yes, like me, others will also want it. They did not initially. But as time went, they realized, yes, this is something which not only we need to be afraid and grieve about, but we should extend our help. That is where the disaster management came in at Chennai. There have been many voluntary organizations, social service organizations, and youngsters who have come to the forefront with an idea to just, help everybody through this pandemic. So the disaster management on par with the floods or the cyclone was different. Even any disease would have been different. But now, during this COVID situation, this pandemic, which has erupted after a span of 100 years, has taught us to live a life, a meaningful life, wherein we need to give more. What we receive, we need to give more. So how do we manage this situation? I take this opportunity to the organizing committee to teach school children, college children, to bring about an awareness among everybody as to what is a disaster, how to manage it, how to restructure certain things. It is more the governance. Who is going to govern these? We should all come up saying that I will be able to do this in my capacity. Somebody else can say, I can be able to. If one person is going to provide food, the other person should be able to arrange shelter. So that is the way we can manage the disaster. So this disaster management and this construction and governance, this body has really helped through this disaster, this pandemic, which we can consider to be the greatest disaster of the century. And I'm happy that we have sailed through it. It's yet again a little more time where we will be on the normal footing. But this disaster is something which is not foreseen. We were not forewarned about it. So the spirit in people giving, the spirit in helping out was sort of natural instinct. So it is not that it is not there in all of us. All of us want to help, but we do not know how to do it. We are not aware that such associations as yours is there. We do not know that we can reach out to your associations and be a volunteer. We can help in a way. All what we did is in our individual capacity, we were able to mobilize certain funds or through friends, close friends, family, and do it. But if these organizations are widely publicized and the activities are also widely spread out to the common persons also, those ever who wants to help would come out. Of course, Lions Club, of course, Rotary, without a doubt, we have been doing a lot of good services. But when you have a separate association where you can come together and do for the society at large, notwithstanding any community, caste or creed or lower income group or higher income group, anybody with a mind to help out, then that is going to make a difference. So this disaster management or risk governance or anything, whatever you name it, should be publicized and people should get to know. It should not be within a particular district or a particular city or cater the needs of the district or the city. It should be to the public at large. It should be open to all. Whoever wants or whoever has the inclination to help out, whether it is disaster or whether it is a pandemic or anything, any natural cause, we should come about together as one. My predecessor who spoke just said, Yadamure Yavarum Kiliyat. Yes, we are one. So we should come together, and even whether it is a time of difficulty or happiness, we all stay together. As regards Rotary Club of Chennai Bharati, they have Rotary Club of Chennai Bharati is doing a wonderful yeoman service from the year 2015, from the time the floods we were affected at Chennai. 2015, the floods, the cyclone 16, and the 19, where we touched upon a small cyclone, but then God's grace, we did it. There have been fire incidents in Chennai, in and around Chennai, and the Rotary Club of Chennai Bharati's community health Dr. Renuka Ramakrishnan, who is the chair for the community service health, is doing a yeoman service in her individual capacity and as a member of the club. So she would also be speaking here, and she'll be able to tell you more about what the services the Rotary Club of Chennai Bharati has done. We should also appreciate Dr. Renuka Ramakrishnan for having done all this even in her individual capacity. She has done through the club and as and when required in her personal capacity. So thank you, Doctor. I take this platform to thank you very much. And I also thank that this is what you say. This platform has been arranged by Dr. Renuka. I appreciate the thought behind, and I thank all of you for giving me this opportunity. I request this association to take it about to all districts and all cities and create an awareness saying that there is a disaster management association which looks into it, and that we could be part of it. Please open your doors to all members, mostly the youngsters, because they are the high-spirited people who like to be in the forefront, who voluntarily, without thinking, without a second thought, no, their mind, they want to do it. That's how they come to the forefront. So without any regard to caste, creed, culture, anything, they come out. So I request your association to open this door for the school and the college students. Thank you.
Thank you very much, madam. You have passed a ruling that disaster management education should be mainstreamed in the curriculum. The entire humanitarian organizations, including Indian Red Cross Society, DMRT, all connected organizations working for it. We require your support. The government of India in the CBSE curriculum, 7,000 schools are imparting disaster management education on 9th standard. Here, Tamil Nadu government SDMA started as a move. We have devised the syllabus, books were prepared, but it is not included in the regular academic stream. So here and there, like a rat race, things were taught. And now it is the August forum. Dr. James R. Daniel, great academician, Professor Vinod Chandra Menon, Suresh Maria Selvam, and our advocate here, and our governor, together we should request the government, respective health ministers, respective health experts, to take this message that our children should be taught like a Japan. When there is a call, they will, from 14th floor, in 2 seconds, they will come to the safe zone when there is a alert message received. So such preparedness, early warning system should be possible only if this disaster management subject is mainstream in curriculum. Thank you very much, madam, from all the organizers. We thank you. Your time is very precious. So still you connected. Thank you very much. Now, the very powerful humanitarian activists, well connected with me from 2015, night and day. My husband is earning, I am spending for community. That was the key message she has given. She is a recipient of many awards from Governor of Tamil Nadu, Chief Minister of Tamil Nadu, and doing a marvelous job, especially in the less cared, rather uncared community of leprosy patients. So as a dermatologist, as a humanitarian, as a Rotarian, you are doing an excellent job that we appreciate. Now the platform is for you, madam, Dr. Renuka.
Good evening to one and all, the dignitaries as well as speakers of today. I really wanted to do this. It was inside my heart. So I just requested sir, to Suresh Kumar to do it. And then I am so happy today that he made my day, that I was able to do this program with his help. And Rotary Club Chennai Bharati is really proud to be a part of this program. I just want to say a few words, start off with a quote saying, humans aren't as good as we should be in our capacity to empathize with feelings and thoughts of others, be they humans or other animals on earth. So maybe part of our formal education should be training in empathy. Imagine how different the world would be if, in fact, that were reading, writing, and arithmetic, only empathy, empathy, empathy. This was a quote by Tyson. So I wonder, this quote always helped me to realize the fact that where has humanity gone? Really, during this COVID situation, we have been seeing lots and lots of, as a frontline, COVID frontline warrior, as well as doing a lot of services to the society. I have been hearing hues and cries of help. How do we have never felt like this before. We have had all the disasters on earth, natural disasters, we call it different kind of disasters. Such kind of pandemic, I think we have not had for a long time. Are we all prepared for it? No. Not at all. None of us are prepared for it. We really don't know what to do. But then we, from like Indian Red Cross Society, sir, I'm really hats off to you, sir. Really all the blessings to you for doing so much of work. And I really thank Line, the district governor, sir, also for doing excellent work, and all the Line and the Rotarians and each one of you who can help each other, one another. So it is not an individual work. There is no I here. It is we. As a team, we can help each other in this crisis situation. What I feel is that, according to me, we have been doing from Rotary Club of Chennai Bharati, as Suresh Kumar told, from 2015 floods. We from Rotary Club of Chennai Bharati were involved. We went into the waters, and of course the NDRF, I was one of the team member of the NDRF. I thank NDRF for giving me an opportunity to be on the WhatsApp group of the NDRF team. So I could save many lives as a doctor. We could manage many deliveries also, which we had done during this twin deliveries, which the children are really happy, and now they are all big enough. So we are very thankful to NDRF also. We also did from Oki cyclone. You all know that your Kanyakumari also, we had done through Rotary Club of Chennai Bharati, lot of help. And then again, Chennai was hit by many other things. So we were really worried, and we had done a lot of things. But then this condition of pandemic, where are we? I really wonder. Where are we? Nowhere. We have not reached anywhere. We have not, I don't know. Nobody knows. When is it going to end? Can anyone answer to my question? No, not at all. We are all really sad feeling that. But in spite of that, each one of you, each one of the person in this, suppose I live in this street called Shenoy Nagar, I would say that our association is there, is the Shenoy Nagar area. It's called Shenoy Nagar Welfare Association. Just for example, I'm telling. So here, each and every individual has taken a responsibility that anybody or anyone having any symptoms of COVID immediately is taken to the nearby center. We don't see that the neighbor, if somebody gets COVID, we think that they should not go to the neighbor's house and all. But here, it is all that everybody helps each other, and we are giving food to them. We door deliver to the food to their house, on the front of the house, then they will pick up. So a lot of quarantine people are here. We have been seeing through this situation, it is really sad. But the thing is, here lies the humanity, what I was talking about, empathy. I know that NDRF exists. We all know that Lion exists. We all know that Rotary exists. But do we all know that all of us together are working for the same cause? As service to humanity is above self. All of us are working for the same cause. And this COVID situation, what the government is doing their part, but we as human beings need to do our part. And we, as all of the individuals are here, as well as society, I think we need to do, each one of us need to do our part. what we are doing as doctors, we have been doing as COVID warriors, we have been doing in the front line, we have been working. I have a daughter who is on just 27, but then she's also MD pediatrics second year. She's doing every day, she's seeing COVID patient, at least 10 deliveries per day. So don't I allow her inside my house? I can't throw her away from my house, right? Because she's seeing patients. This is where we die. We have to stay united. Don't be scared. No need to be scared. We can come out of the situation. 2021, this 2020 can be erased from our mind. But then 2021 will definitely be in a very higher situation. We all need positivity. Bring in positivity in life. Each one of you bring in positivity. Group prayers can help wonders. I have seen many people in the hospitals, as Sir told, that group prayers are seen more in the common in the ICU outside. Exactly. That is the situation we are in now. ICU wards outside, people aren't even having a situation where people are there, relatives are there. They don't know who is there. All are isolated. All are quarantined. They don't know who are there, the house, who is having corona, who is not having corona. So this is the condition we are in at this present situation. So I would like to say that it is very difficult to deal with this condition, but I definitely want the youngsters. I will say that there are people with me in WhatsApp groups. We have formed different WhatsApp groups. Like, for example, Quick Action Force is a WhatsApp group formed in 2015. We have a lot of volunteers there. More than 250 volunteers are there. Like that, each WhatsApp group has got 250 volunteers. There are, in Chennai, I'm talking about, there are 15 zones. We have divided ourselves into 15 zones. So each zone 1, zone 2, 3, like that have got volunteers. All have 250 volunteers. In any emergency case, we are able to manage. We are able to go and help the needy at a particular moment. So we are indeed very happy, and we are indeed very happy to be a part of this wonderful program of today. As I would say that the nurses who are the frontline warriors, not only the nurses, the paramedical staff, everyone are to be thanked for today for being there in there. This disaster management is a course, has to be included in the curriculum, as rightly said by my President Swarnalata Mahesh, has already been included in the curriculum. But I would say that seminars, webinars have been having and having. Our whole world is full of knowledge. Where is the knowledge of this COVID situation? We have to be prepared. We have to be really fight against it and come out of it. Only how can we do it? We can all join together, as Sir told. All of us can join together, one another, and concern for each other, empathy. All this only bring down this COVID situation, and follow the rules and regulations given by the government. Again, I say that most importantly, that we have to go around telling people awareness is more important. There are not many people in the villages who are not even aware of this COVID. Can you believe, sir? I'm really telling you that there are many villages where they don't know that COVID, what is COVID? So they are telling, what is corona na ennamma? They are asking me. So I have gone into this webinars conducting about through my club as well as individually to the various villages, and told them that how to take care of themselves. The prevention is better than cure, as Sir has already told. Yes, prevention is better than cure. So we have told them about the importance of wearing masks. We have told them about how they should keep their environment clean and how they should use their sanitizers and wash their hands. Everything has been told. And social distancing, everything has been told. We have been telling and telling and telling. More has to be told. We have to integrate systems. Please integrate all the systems together. Like, for example, Rotary, Lion, Indian Red Cross Society, everybody should be integrated. This disaster management committee should please involve us. We are ready to offer our services, sir. We are here to service. We are all humans, only human, no religion, no caste, beyond everything. We are here to serve the humanity. I believe that whatever we can, we will do our best to serve the humanity. And we have also done a lot of COVID plasma donors. I have seen that there are a lot of COVID plasma donors are ready to go, sir. During this COVID times, very difficult to go, during the lockdown period. We have more than 150 COVID donors have been given importance, and they have gone and given the blood and saved lives. Moreover, we have also started a Rotary Club of Chennai Bharati had started a new innovative thought called geriatric mind care, where we went around to old age homes only through web. I mean, we cannot go directly. So through webinars, we have conducted the geriatric mind care. There is a lot of suicides. People are coming to me in the midnight and calling and telling they're having suicidal tendencies. We are saving them, sir. We have to save them. So this kind of thing has to be told to them also. These old age homes, all orphanages, physically disabled people, mentally disabled people, all need us at this time. And I wish that I could be a part of DRDF. Once again, I request and thank you one and all for giving me this opportunity, especially Suresh Kumar. Really, thank you so much for organizing one day, and I'm really thankful to everyone. And I would like to say that presence of Rotarian Suguna Devi Murugan, my past president, as well as the youth service director of my club is here, and Rotarian Sujita Samuel, secretary of Rotary Club of Chennai Bharati is here, and my friends Praveen Vora from is also here, who is again a very big humanitarian who is doing lot of services, WCD work. So I have a lot of people from Rashtrapati Bhavan, Dr. Ilava Rasan, so many people are here. I thank each one of you who are here to spend this time with us for this management of disaster. Thank you so much, one and all.
Thank you very much, madam. Very interesting, confidence building speech. As a medical doctor, medical fraternity, you strengthened, rather you have killed the fear psychosis among the COVID people. You touched empathy, sympathy, humanity, all these words, especially the geriatric or palliative care that you have initiated is highly appreciable. Standard operative procedure of government, do's and don'ts, many areas you have touched. Above all, the voluntary forum, you yourself formed and demarcated different zones. That is highly appreciable. I hope this August forum will work for a voluntary forum, as voluntarism is the backbone of any humanitarian organization. Thank you very much, madam. Now, I will give you a small presentation about the theme. Yes, the International Disaster Risk Reduction Day is 2020. This is the theme. So this year's theme is disaster risk governance. You can measure good disaster risk governance in lives saved. We have to save the life for any disaster. Whole organization is focusing for saving lives and reduce the number of affected people. If at all there is a disaster, we have to, if there is any early warning received from IMD regarding the cyclone or heavy downpour of rain, the community is rather shifted to the safe zone. So we have to give provision, helpful support to the community, as Dr. Renuga was doing in 2000 flood situation in Chennai city. COVID-19, it is a climate emergency, are telling us we need clear mission plans, competent empowered institution acting on scientific evidences for public good. During this COVID era, many organizations came forward to support the community, especially our guest workers or migrant workers. And our Professor Vinod sir has, during the first presentation held on 1st August, how their legs by walk, thousands of kilometers they walked, and they were stranded. Many of them died in the railway gate and railway lines. So on the road, many died. So like that, the situation unanticipated. The disaster management system in India initiated way back in 1999 with high-powered committee. That high-powered committee identified a lot of 32 major hazards in India. So in that, biological disaster is one. They have given 25 recommendations. That recommendations are still live document. So let us focus today's program agenda in a video, short video that you can watch. Okay. At the end, we will play the video. Next, we will move on. Okay. So, Sendai framework mainly focus on socio-economic vulnerabilities. The vulnerable area of your locality has to be identified, whether we are prone for flood, whether we are prone for earthquake or cyclone. So that vulnerability list we should have. How many villages are getting affected during any hazard? That particulars as a club volunteers, club office bearers, we should have. Then only we will come to know where we have to work. So local community has to be given early warning. The early warning messages are being received from IMD and respective disaster DDMA, District Disaster Management Authority. That information has to be reached. The last mile connectivity has to be established. This entire framework is a 15-year non-binding agreement. So the India is one of the signatory to implement 100% Sendai framework. All the major parameters has to be implemented in India. So the main focus of this Sendai framework is understand the priorities. We have to prioritize the four main key areas. That is understanding the disaster. As I told, we have to identify what are the disasters getting affected in our villages or in our nearby area. Strengthening disaster risk governance to manage disaster risk. So what is the lacking factor? Whether we have first responders, trained first responders before us, that we have to identify and we have to support. So that first responders are mainly supporting when there is an emergency. The professional team will come and support at the later stage and then invest in disaster risk reduction. So all the developmental plan, the risk governance, risk disaster risk reduction program, government should invest. And the final point is build back better. The whole system of disaster management speak about build back better. We have to see when there is a hazard affecting that community, we have to rebuild, rehabilitation part. So preparedness, if we do better, the relief and rehabilitation exercise will be very easy. So this entire framework always focus about the strategies that address just a single hazard like flood, storm. Any disaster, climate-related disasters are mainly disturbing in Indian context. So we have to work for it. So national level and local level initiatives we have to take up. This Disaster Risk Reduction Day initially initiated in the year 1989. So in the 1989, 13th October was earmarked as a International Day of Disaster Risk Reduction. So the global community joined together and decided to work for it. So this system of World Conference outcomes we are implementing for betterment of the community. And the allocation of emergency response is very important. And if at all there is a risk, we have to hazard and exposure and vulnerability has to be categorized, and we have to reduce the death and loss of damages, and we have to make analysis of the trend. So these areas we have to focus. And the city vulnerability. See, when we take in the whole world, 5% of the community is living in urban area, and in India 9%, in Kerala 60% community living in urban area, and especially in Kanyakumari 40% of the community live in urban area. The urban flooding became a challenging task. So to safeguard the community, and seismic zones, earthquake also another issue, challenging task. The early warning system yet to be programmed in a systematic manner. So many this earthquake will not give any warning before it comes. So we have to prepare ourselves. Resilient construction we should make. Our governor is here, is an architect by profession. So whether the construction in the cities are disaster resilience, that we have to focus. For each hazard, we have to identify whether we are prepared for it. And another area is key area is the Prime Minister's 10-point agenda. The last 2016, Prime Minister has hosted Asian Ministerial Conference. There, 10 points were unveiled by our Honorable Prime Minister of India. The first one is all development sector must imbibe the principles of disaster risk management. Whatever disaster, development initiatives you take, we have to give response to the environment study, we have to conduct, and the community has to be disseminated before implementing any project. And then the second one is risk coverage must include all, starting from poor households and multinational and corporation to nations. That is insurance coverage to all the people in the community. 138 crores of population in India should be covered. Mr. Respected Chandrasekhar sir is here. He is a best practitioner. You served in NDMA. He is also associated with us. He will be giving his lecture shortly about this topic. Women leadership. Women leadership. Last week we had a program. Mrs. Brinda Adige from Bangalore. She's working for human trafficking. And one J. Surathanam from Kadalur and Dr. Suja from Coimbatore, they joined, and women should be, during any disaster, women are getting affected. They are the most affected people in almost all the disasters. Especially we have our Rotary Ladies Club and the Line Ladies Club in our folder, and our spouse members should be given our dissemination of all these disasters. And because during emergency, when there is a woman is stranded in a particular place, we require women volunteers to support them. So we have to invest in risk mapping globally, improve global understanding and nature of disaster. Risk mapping is very important. Then only we can decide what to do, what not to do. Technology is ruling. This meeting is hosted only because of the technological intervention. Otherwise, connecting from Pune to Trivandrum, Kanyakumari to Leh Ladakh, it is not at all possible. So the technology is ruling, especially in this COVID era. New dimensions are taking place. And we hope the sixth one is develop networking of universities. See, Madam Advocate has initiated that educational system should be mainstreamed, disaster education. So Prime Minister already chalked out in his agenda that networking of university, that is on its way. I hope it will be implemented. Utilize opportunities to provide social media. That is also another area. We are connected with the social media very much. So we have to implement our agenda through the social media. Our activities we have to disseminate. Then only the young community, young generation will easily access to this subject. Build a local capacity. Whatever global agenda we have, that has to be localized. Think globally, act locally, as our chairman, James R. Daniel sir said, that we have to implement the project applicable to the local community. The ninth one is make use of every opportunity to learn from disaster. So every disaster will teach us a lesson. That a lesson learned, we have to work for it, and we have to use it for minimizing the loss. The final one, 10th point is bring about greater cohesion of international response to disaster. If the disaster is not compatible, acceptable, manageable by the local community, we always depend upon international response. We have experienced international response during tsunami and many other hazards in India. So these points we have to take to the community, so that these points will be the focus area throughout the year. We have to practice it. Then definitely India will be disaster resilient country. Thank you very much, friends. So if at all you have any doubts, you can call us, contact us. Every Saturday, 4 to 6, we are organizing the series of webinars under the leadership of Professor Vinod Menon sir and Michael Vedasramani sir. Let me try this video if it get open. Yes.
The Sendai Framework for Disaster Risk Reduction was adopted on 18 March 2015 at the 3rd UN World Conference on Disaster Risk Reduction in Sendai, Japan. It was endorsed 3 months later by the UN General Assembly. The Sendai Framework is a call to action over the next 15 years to make the world a safer place and to reduce the risk of man-made and natural hazards. It is designed specifically to achieve the substantial reduction of disaster risk and losses in lives, livelihoods, and health. Preventing new and emerging risk and reducing existing risk is essential to any substantial reduction in disaster losses. It has 4 main priorities. Priority 1. Understanding disaster risk is about ensuring that policies and practices for disaster risk management are based on a clear understanding of vulnerability and exposure to hazards. Priority 2. Strengthening disaster risk governance means having a clear strategy, strong institutions, laws, and budget to ensure the efficient management of disaster risk.
Is it visible? Is it visible, Dr. Savita? Okay. Choose the video. Now it's visible?
Yeah.
Yeah.
Yes.
The Sendai Framework for Disaster Risk Reduction was adopted on 18 March 2015 at the 3rd UN World Conference on Disaster Risk Reduction in Sendai, Japan. It was endorsed 3 months later by the UN General Assembly. The Sendai Framework is a call to action over the next 15 years to make the world a safe place and to reduce the risk of man-made and natural hazards. It is designed specifically to achieve the substantial reduction of disaster risk and losses in lives, livelihoods, and health. Preventing new and emerging risk and reducing existing risk is essential to any substantial reduction in disaster losses. It has 4 main priorities. Priority 1. Understanding disaster risk is about ensuring that policies and practices for disaster risk management are based on a clear understanding of vulnerability and exposure to hazards. Priority 2. Strengthening disaster risk governance.
Mr. Suresh Kumar, I think, can you hear me? Hello? Hello, can you hear me?
I'll give him a call, sir.
Yeah, I think, we can request...
I'll call him.
No, we can request Professor Suresh Mariselvam to initiate his talk because, I think... Can you please start?
Yeah.
Thank you. Thank you very much.
Thank you. Good evening. Good evening, Professor Menon. Good evening, all the governors, presidents, dignitaries in the forum, respected members.
May I request Dr. Savita to briefly introduce you, Professor Suresh?
I think I can introduce myself.
Oh.
So because time is there.
Okay.
So I'm Suresh Mariselvam. I'm very happy to meet Dr. Renuka because I was part of the leprosy eradication program. I was working for Danida for 15 years. I'm one of the instruments in elimination of leprosy. Because basically I am a software person, but while working in the project of leprosy elimination and tuberculosis, I switched over from information system into humanitarian sector. Now I have become a humanitarian sector person, and I was working for NRHM, National Rural Health Mission in UNFPA, Odisha, and then by the time tsunami hit and I was posted in UNDP in Chennai, then I was working for UNDP for almost 10 years. And at the end of it, I wanted to share my experience with the youngsters. So I joined in the teaching fraternity. I was teaching in SRM Medical College for the medical students. And then I wanted to teach the management students and engineering students on social values. So I joined VIT. I was teaching VIT for 5 years engineering and management students. And for the past 2 years, I'm independently working with NGOs and community forums. So this is a brief background. So I have different kind of experience every phase. I never planned anything of my career, but whatever came on the way, I accepted and I made myself available for the teams which I was working together. So that's the first thing I always start. What is the purpose in life? So let me start because I'm running short of time. Thank you very much. It was a wonderful forum to hear everyone, the former speakers, and I would like to interact for each and every talk. I would like to interact and discuss, but now time is running out, and the topic given to me is the role of humanitarian agencies or humanitarian organizations, what we can do. I'm looking into two things. One is international agencies who are acting as a donors and guiding factors, like UN officers or international donors or any other public-private partnership. That's one thing. So they have a fixed agenda. But I want to talk, and I'm considering humanitarian agencies like Lions Club and Rotarian Club and Red Cross. And what we can do, from my experience, I would like to share quickly. I'd like to share this video with you. So I'll take quickly. I'll go through my talk based on Chennai data. There was a study conducted by Kyoto University and Madras University. It was a Krishnamurti organized it. It was in 2008 and 9. After the tsunami and before the Chennai floods, there was a study, and based on that, I want to present my topic. The first thing is the disasters are on the rise. You see now the frequency of disasters is increasing, especially in the last 20 years. We have come across almost 15 to 20 small and big disasters, including the COVID. But development is concerned, still we have to go a long way. And still we have villages who do not have electricity. Like Dr. Renuka Madam was talking about, there are villages who do not still know about what is Corona and what is COVID and what to do in case if I am affected. So still we have got a long way to go into the development. The third one is the interventions of, we are all coming together whenever the emergency is there, and whenever the emergency comes and hits us, we talk only about that. If it's a flood, we talk about flood for some time. It's COVID, now we are talking about COVID. But my topic is always interdisciplinary, multidisciplinary, and multi-hazardous situation, how we are going to act and what kind of preparedness we have. And that is a continuous process. It is not one day process. Every time what we learn, so that is why we should always ask the question, what is the purpose of life? What is the true meaning of life? Is there a purpose to life? What gives our life a meaning and purpose? And how do we live with a purpose? That's what I was telling when I was working for Leprosy. When I joined as a software person, a management information system person. And the prevalence was 189 per 10,000 population in 1989. But when we completed in 10 years, it was a wonderful public-private partnership. Government of India, the state governments, NGOs, hospitals, surgeons, all the entire team plus community teams, they all worked together. In 2000, we declared less than 1 per 10,000 population. Tamil Nadu stood first, and then we integrated the leprosy system into the mainstream. And a lot of things happened. So the purpose of life is to live it, to taste experience to the utmost, to reach out eagerly and without fear for newer and richer experience. And once you get the experience, share with others, make them be prepared for the situation, what we have seen, and ask them to pass on to the next generation, and it should be a continuous process. Then only the purpose of life gets filled up. So what we are going to see is how to successfully address holistic, integrated, and comprehensive DRR. Is it possible to bring government organization and humanitarian organizations together for better preparedness, mitigation, and response? So this is a small place in Thailand. I just want to show this picture. This is, this was clicked before tsunami. It's a beautiful small island where a lot of water games and entertainment is there. And immediately after tsunami, the next day, only this much was left. You can understand the impact of a disaster like tsunami, how it affects all of a sudden. Now, the same thing we are talking about in COVID also. We never expected, because since we are not prepared, it seems to be, it's a huge loss in human life as well as in economic life and in many other ways of life also. So as long as the preparedness level is low, naturally we have to pay a big price for it. So Chennai profile will take it. The 10 zones, this I'm taking now, it is 15 zones, but 10 zones, according to the study done in 2009, the population rate is 1.72%. That time, 1971 to 2001, based on the population state numbers for the past decades. Now at present, it is 28,000 something. Now at that time, 26,768 per square kilometer. That's the population existing in 2009. So there are 5 capitals are there. There's social capital, physical capital, financial capital, natural capital. Each capital, the zones were identified. Each zone was examined, and then the data was collected. But I'm giving the overall thing since there is no time. So the first thing is social resilience. Social resilience consists of the population, the health status, the education awareness, the social capital, and the community preparedness. How much? So looking to it, the population is low, but compared to the population, the health is much better. The education, to certain level, it is considerably okay. But the social capital, livelihood options, and the people, how much their social values are being utilized, is not up to the mark. It's only 1 point something. Whereas community preparedness, due to the tsunami, thanks to tsunami and the involvement of all the international agencies and local agencies, NGOs and government, then the community had developed some kind of preparedness. So it is at most 2.5. It's considerably okay. But the only thing is it has to be nurtured further. And next comes the physical resilience. That's electricity, water, sanitation, accessibility to roads, and housing and land use. Am I audible? The pictures are clear? Hello? Am I audible?
Yes, sir, very clear.
Yeah, okay. So now this is the physical resilience. Now electricity, water. Now electricity is concerned, Tamil Nadu, Chennai, they have achieved almost the entire city is covered. Electricity is available. Water is concerned, now new areas are coming up and still the water issues are to be handled. And sanitation is the one issue, and solid waste management. Now it is picking up. Now we are concentrating on solid waste management and disposal. And especially the new systems have started now. And community is getting trained on segregation of solid waste. I think this will improve. This needs more attention. Accessibility to roads is another, next to electricity. This is one good thing happened in Chennai. It's well connected. So the mobility of the people from one place to another place is very easy. So even during disasters, distribution of services, needs and food and everything was well planned and it was well taken care. But housing and land use is concerned, this needs little more area because a lot of water resources have been covered and new areas have come up. Because of that, the water is getting overflowed and it is getting stagnant some places. That's why the housing is not been properly planned and the land use also had to be taken care of. So this is about the physical resilience. Economic resilience is concerned, all are equal. So income wise and employment wise, people are getting employment normally, and the household assets are there, and finance and savings and budget and subsidy. If you look at it, it's between 2 to 3, 2.5 to 3. So that's moderately okay. And institutional resilience is concerned, the institutional collaboration from the government, from the corporation, it's very good. And crisis management also is very well handled. Only thing is the knowledge part. This is what we have to concentrate a little more. The knowledge dissemination and good governance is what we are talking about. This needs one thing. I would like to share about what we did in UNDP. Professor Menon is here to add his views. We had one center called Tamil Nadu Tsunami Resource Center. It's purely an information center. All the information, it's one window shop. So all the information related to shelter, water, sanitation, child, education, environment, disaster management, communication, information, early warning, social equity, everything. We had a sectoral experts, and then we collected the information from the community. From every player, from whether it is UN body, or it is a WHO, or Government of India, or NGO, or a small community group. Every information was collected and it was properly divided into sections and it was put in the subcategories. So it was anytime it was easy. So we had a website called tntrc.org, which was having information sector-wise. So we had 40,000 taps every day. I'm talking about 2007 to 9, 40,000 taps all over the world. Those who wanted to donate money, those who wanted to know about it, how we handled the situation, everything was documented. We had a newsletter also. We didn't have at that time this much development, but even then we could get the maximum support from the experts and technocrats. So we had everything documented, and anyone wants to do anything. Dr. Renu was talking about, everyone has got a role, but where to do it? Unless otherwise you don't know the direction, you'll be getting stuck. So this is where again I'm insisting that Rotary Club and Lion Club and Red Cross we can think about, and we can have a dialogue with the government and with any institution who is ready to have an information center where we can collect all the information, keep it ready. So round the clock information will be there. Anytime anything comes over, then immediately the resources, it could be of economic resource, or it could be a physical resource, or it could be of natural or human. The resources could be easily allotted, so the right need will get the right supply. So this is about the institutional resilience. Next comes the natural resilience. Now this is again, this is a normal, up to 2 it is, that is intensity of severity of hazards. It is under control because after tsunami we had series of this thing, but the control is there, and frequency of hazards also. It has not come to the danger zone, but still we have time to breathe, and ecosystem services have to be taken little care to take care of the resources, land use, and then environmental policies has to be little more streamlined. So overall, considering all the 5 capital, physical, social, economic, institutional, and natural, so we have the highest is institution. Institutionally, we are well prepared. Government has got everything. It has got the well-organized system. Everything is there. But only thing is, the least is the natural resources, the land use, and the water reservoir management. That has to be little taken care. And the physical infrastructure has to be slightly moved. And social capital, economic capital depends on the livelihood promotion. When the economy goes up, naturally the social capital also have a better spending nature. The poverty will be alleviated. Then the physical infrastructure accordingly will increase. Then natural has been taken care, institution is there. So if it is reaching between 3.5 to 4 all equally, then that is where we can have a resilient community. So considering this developments in 20th century, so we have electricity, petroleum, automobile, aeroplane, water supply, everything is available. The world has come, shrunk, it's on the pump. So one side it is development, the other side it has got its own negative side. So disasters are there. So banking, economy is increasing, medical pharmacy increasing, life expectancy is more, communication system, everything is there. But still what happened, because of this market, open market, there is a lot of new areas are coming up. The flow of money is increasing. So the population also simultaneously increasing. Migration happens. Now see, now we are here. It's 130 crores. Now because of the measures taken by the government, this will go up to here and then slowly it will start coming down. In 2100 only it will start reducing. Till then we have a responsibility to feed this community. So because of this, you see after 2000, this increase in disasters because of the development. So the global market is increasing. One side the economy is going strong, other side the poverty is also there. So balancing between these two is very difficult. So the natural resources also been not taken care properly, and deforestation in the name of development, forests are cut down, and the water resources are not taken care. So mass movement of people, volcanic activity, wildfire, landslide, earthquake, extreme temperature, drought, and we, especially developing countries, have become tired of giving all the relief and all the time relief that get a deep hole in the budget. So before going to that, I'm not going deep into it. I'm just giving the 4 areas so that you can understand what we can do in every sector. You can decide which area is comfortable to you, and then we can decide. So first we should understand what is disaster management. The first thing is there is an hazard, there's a prevention, vulnerability. Hazard is nothing but any object, situation, or a behavior that has the potential to cause injury, ill health, or a damage to life, property, or an environment. So it could be anything. It can cause, if it controls, if it loses its control, it will harm us. So the control, as long as the control is there, it is called a hazard. And we have something called prevention. because we understood what is going to happen and we have a prevention. It may oversee, it may exceed the prevention capacity, and so we are still vulnerable. The community is still vulnerable. So the exposure is, we are exposed to, suppose the water stagnation. If the rain, yesterday it was raining, the water stagnation so much, I was in Poro, almost knee-deep water. And it would take minimum 3-4 days by the time the mosquitoes bleeding may start, and it may cause, so people are exposed to that. So again, there is a cause of malaria may happen. So the exposure is threats when there are no protective measures taken and people are exposed. And the vulnerabilities, what kind of impact it can have on us. So that's a vulnerability level. And prevention is how we can prevent from the situation. And capacity is when something happens with somebody, some early warning is given before something happens, and we can get rid of the situation and have a capacity. The risk level is very less. And the disaster is nothing but disasters result from combination of hazard, is a hazard, and then conditions of vulnerability and beyond the capacity. So this is the capacity we have prevention, but beyond the capacity, if it comes and hits us, it depends on the momentum and the flow and the speed of the rock which is falling apart. So it is if it exceeds the capacity of what we have, then become a disaster. So other than that, mitigation is another section where we can have alternative arrangement to safeguard ourselves. So this is an example I used to give to the students, but this is a real thing happened during this landslide in Ooty. Now watch this. This is the exact situation I was just explaining. This is a real coincidence.
Oh, gede.
So this is a situation, anytime anything can happen, but before something happens, we should have some kind of study, and vulnerable areas should be identified and make some prevention, preparedness and mitigation. That is during peacetime, it is the normal time. And during the disaster, the central thing, risk is calculated, the hazard, which is a probable event which can cause harm to us, and the kind of vulnerability depends on the exposure to that, and how much capacity we have. That's the preparedness we are talking about. So it depends on this. Then the risk level will be low or high, depends on the level of the hazard and how much vulnerability we have when we are exposed, and the capacity to face the situation. So this other side, this is post-disaster situation, that is the rescue, relief and rehabilitate the community. So this is the pre-disaster, during disaster and after disaster. If you can understand this, then I can very clearly mention, then I can give you the options at which you can decide which area we are suitably put our efforts. So considering all this, so 1989, International Decade for Natural Disaster Risk Reduction started in 1989. In 1994, the Yokohama Strategy of Plans of Action, where all the developing countries joined together because they were tired of spending so much money on relief, and then so much of natural resources were getting affected and damaged. The impact was quite high. Then they decided the assessment of a risk and then disaster prevention should be the priority. That is in Yokohama Strategy of Plans and Action. And in 1999, International Strategy for Disaster Risk Reduction was formed. It's exclusively a UN body for handling the disaster risk reduction. And now, 2005 to 2010, we are following Ayyappa framework of action, where the building resilience, that is build back better concept of bringing the stakeholders, building partnership and common system of coordination strengthening was done. This is the time we formed this infrastructure arrangement like NDMA, SDMA, GDMA and Panchayat level, and Disaster Management Act was introduced in September 2005. And now in 2015 to 2030, we are in Sendai framework, which Suresh Kumar sir has very clearly explained. So I need not go. So these are the targets. So we have to reduce the mortality. We have to reduce the affected people, number of people. We have to reduce the direct economic loss, and then we have to the damage to be reduced. But what we have to increase is DRR strategies, support to the developing countries, and access to early warning. So these are the things to be increased, and these are things to increase. But one thing is, this goal is very well designed, but well thought. You see now, if you read it, prevent new and reduce existing disaster risk through the implementation of integrated and inclusive economic, structural, legal, social, health, cultural, educational, environmental, technological, political, and institutional measures that prevent and reduce hazard exposure and vulnerability to disaster, increase preparedness for response and recovery, and thus strengthen the resilience. No words beyond this can explain. Such a wonderful definition talks about everything, every sector, maybe anything, from the highest office of this country, of this earth, to the last person, last mile person. Everyone has got a role to play, and the priorities have been well defined. So, International Day for Disaster Risk Reduction was the International Day was started in 1989 after a call by the United Nations General Assembly for a day to prompt the global culture. This year, we have this disaster risk reduction for the governments, how the governance has to be properly steered and put into action so that the rest of the crews, like all the stakeholders in the building partnership, they can also bring their resources. So we can measure good disaster risk governance as lives saved, reduce number of disaster affected people, and reduce economic loss. This year, especially everyone, all the speakers are talking about COVID-19. The climate emergency is another area, like COVID-19. The climate emergency is not taken care. This kind of virus attacks are going to be very frequent because the biodiversity is a baseline behind everybody's life, nature. And if one link is cut, it's going to have an impact on another link. And the climate emergency also to be taken seriously and need a clear vision, plan, and competent, empowered institutions. So this is a cycle. So this is the disaster happens over here. We are giving a response, rehabilitate, reconstruct. So this is the crisis management, the right side. And then once the normalcy returns, then you think about how it happened, how the disaster happened, what was a hazard, where the control was lost, and what was the level of vulnerability, and how much capacity we had accordingly to strengthen the prevention, mitigation, preparedness by giving the early warning. So that next time the similar situation comes, we should not have this much of loss. This is what the Senda is insisting again and again. So second thing is, people always think about hazard means always a natural hazard like earthquake, high winds, or flooding, or volcanic. This is all, when we feel it, the whole community, it comes in the media. So people think these are the hazards. Other than that, the economic losses are there, like vulnerability, the unsafe condition where people are living, the unsafe places. Livelihood is option. Now, for example, 6 months, there is no livelihood for many people. Professor Mena was talking about the migrant workers and their suffering and how they are going to survive in future again, whether they are going to work in their own place or they are again going to move to some other place for the livelihood. So we have any uniform way of livelihood distribution, all these things to be looked into it, because this is again a vulnerability. And underlying causes, the poverty is the major area. Poverty alleviation is the first and ever, like prevention of hunger and poverty is the prime motive of UN officers. And the limited access to power structures, limited access to resources, ideologies, and economic system. The health system is concerned with three things are required. One is it should be available, and then accessible and affordable. All three, it is applicable to all resources. If all three are in place, naturally this vulnerability could be reduced. So it's not only the natural hazards, the economic conditions of the people, living conditions also being one of the reasons for vulnerability. Now this, you are seeing, this child is about to die and the vulture is waiting. This is because of the economic policy failure of this country. Again, this is another area where in Africa, this is all taken by Kevin Carter, a wonderful photographer who died later. And the challenge is what we have now, governance is concerned, organizational, legal, and policy frameworks. And next one is risk identification, assessment, monitoring, and early warning. This should be a public-private partnership. Third one is knowledge management and education. Fourth one is reducing and underlying risk factors, identifying the factors which we have discussed now, and preparedness and effective response and recovery. These 5 areas are very important for all the players, all the partners, so we can identify where exactly we fit into it. And then it should be subcategories, and make it to subgroups also. And then each group should be linked with each other. So that in case of emergency, when the warning is given, all the groups come together and they identify their strength and weakness and opportunities and threats. and then put their full effort to face the situation and build back better. So system, the process always have a shock or a stress. This is the context. It's a disturbance happens, and there is an exposure, there is a sensitivity, there is adapt capability. So there are 4 things could happen. We can bounce back better like Japan. Always they come out. They come out with a multi and much more vigorous development, and they strengthen themselves more. Bounce back is like India. We have come back to the normality. What we were earlier, we have come back to the thing. Recover, but worse than before is Solomon Islands. It was in 2010 or 2008, 9. And then collapses like Haiti, which was never expected, that kind of earthquake in 2011. And that's about collapse. It took even this Beirut, recent fire accident in Beirut, and it will take minimum 20 to 30 years for them to build back again. So there are 4 areas. It all depends on how much capacity we have, how much we understood the hazard, and how much vulnerability calculation we have. So other than these natural things, we have sea level rises once happening, and warmest years are there, and ocean heat is threatening us. Greenhouse gases are another area to look into it, and warmest years are the 2015 to 18, and Arctic and sea ice melting is there. So this is again WMO's warning us on global climate 2018. So community disaster resilience is all this thing. There should be an effective communication, understanding of risk and vulnerability, use of local knowledge, social connectiveness, empowerment, preparation, collaboration between stakeholders, developing flexibility and capacity for self-organization. Each one has got a role to play. So from response-centric to relief-centric, we have moved to prevention during Ayyappa framework action, preparedness, mitigation, disaster. Now we are moving to Sendai, where hazard-centric, vulnerability-centric, environment-centric, and adaptation of new policies. And components are concerned, we have Disaster Management Act in 2005, NDMA, SDMA, DDMA, National Disaster Authority, State and Disaster Management Authority. And then other than that, we have donors from all over the world. And civil society involvement as far as humanitarian organizations like Lions Club and Rotary Club. CSO become important players bridging government with the communities. The organization flexibility, informal work style. They supplement government initiatives by acting as a bridge between government. Play an important role in disaster response. So these are the natural and these are the human-induced hazards. The current status is disaster risk reduction is launched by UNDP, partnership with Ministry of Home Affairs. We need to take stock of all the. We have to take stock completely. We have to study first. Then only we can do it. Otherwise, it is like keeping your hand in a hot food. You'll get burnt. Complete study has to be done first, and then understand the vulnerabilities, the possible hazards, and then early warning system. With updation, continuous updation of risk, vulnerability, capacity assessments, mainstreaming of disaster risk reduction, capacity building, and establishing of public-private. These are the 17. This is the center we are here. We have to build partnership, bring this sustainable development goals. 6 is clean water, 7 is affordable and clean energy, 8 is decent work and economic growth, and climate action, and responsible consumption of and production, so that sensible buying and spending nature among the people, so the waste could be reduced. Industry, innovation, and infrastructure. Suresh Kumar sir, can I take another 10 minutes? It's okay?
Sure, sir. Sure. Yeah. Sure, sir.
Now, quickly, I'll wrap this up. I think what we can do, there are 5 areas are there which International Red Cross has identified. I'll start from here. In 10 minutes, I'll finish up this.
Professor Suresh.
Building capacity for disaster risk management. Around the world, governments, international organizations, NGOs, and civil society groups are working hard to build disaster risk management capacity at all levels. But to do this successfully, it's vital they have a good understanding of what works and why. Too often, current approaches are small-scale and poorly coordinated within countries and across regions. But a 2-year research project by the International Federation of Red Cross and Red Crescent Societies found that programs aiming to strengthen DRM capacity can improve their effectiveness in 6 key ways. Number 1. Focus on holistic disaster risk reduction. The first of these is holistic disaster risk reduction. We need to move beyond strengthening short-term emergency management and instead focus capacity-building interventions on strengthening longer-term prevention, mitigation, and recovery. This includes building capacity to consider how risks may change over time, how underlying causes of vulnerability could be reduced, and how different groups may be vulnerable to disasters in different ways.
As Dr. Renuka was talking about, this capacity building among the stakeholders as well as the community. The community-based disaster risk management could be a solution where we can make the community to understand their vulnerability, the possible hazard, and it will lead to social mobilization that empowers the community, ownership and plans and programs, and easier identification of vulnerable groups. This is a continuous process. So let's decide each one. We can have teams also. If we want, we can all have one more session, and we can think about how a continuous process on various rotational responsibilities could be shared, so that a continuous process only can give a better result in disaster management. Otherwise, if there is no practice, all of a sudden getting into a situation will definitely lead to confusion and coercion. There will be a lot of duplication again. So the characteristics, community becomes accountable so that we can put them, because they are the first responders. So the focus efforts of enhancing inclusiveness, gender, other vulnerable population like children, elderly, and differently able people also could contribute. Multiple stakeholders, critical and role of media as a stakeholder, especially in public. And so this could happen. And making the PRA, that is participatory rural appraisal, this is a tool actually where we'll make the community to draw their own village and then identify the vulnerable areas, vulnerable people, and then the possible hazards which may make damages, and then which are the safe places, which are the opportunities, what kind of resources they have. All this thing will be marked by these people. So this was a massive exercise after tsunami. In the 4 years, we have trained almost the entire coastal, right from Tiruvallur up to Kanyakumari, and 470 NGOs were empowered. But ultimately what happened, after the international donors left, there was no one to take it further. After that, it slowly, the NGOs also, they lost their interest, there was no proper funding. And this knowledge, whatever they implanted, it's all slowly disappeared. Till then, it was very well done, and early warning systems were installed, and people made their own pictures of opportunity mapping, vulnerability mapping, everything was done. But that's what, again, I'm insisting, the organization, humanitarian organization, think about having a continuous training, capacity building among the communities wherever they are working, and making the community to draw their own social mapping or seasonal diagrams, which are the areas when it will happen, what a normal thing, and then accordingly make the preparedness plans. It will definitely give a better result.
Strengthen functional capacity. The strengthening of functional capacity is key. That means doing more than just building technical skills and providing vital equipment. Instead, we need to improve people's ability to take effective decisions and action in relation to DRM. This might include clarifying decision-making processes, improving coordination and creating an enabling environment for DRM before disaster strikes.
Is the audio available? You are getting the audio from the video?
Yes, sir.
Okay. Now, this part, we can help, again, second part, one thing is on capacity building. So number 2 is the experts can come forward to make the community as well as the players to make their own village plans, or maybe urban level, the corporate level. In Bombay, it is being practiced. At the ward level, the plans have been made, like physical, social infrastructure profile, resource inventory, and disaster risk profile of village, and contact information of the village, standard operating procedure, everything, whatever to be followed. They all put together, they make the plans sitting with the community, making the plans and kept in the local governance office. It could be a panchayat, or it could be a municipality, or in the corporation, or in the zonal level. So it could be kept so that people are always looking at it, their mind will always will prepare that in case of emergency, which are the evacuation routes are there, where to go, how safely we can reach one place, and it will be easy for the volunteers also to give their best. So these are the teams we have to form: early warning team, search and rescue team, shelter management team, first aid team, water and sanitation team, relief and coordination team. They all will be trained, and we have experts on that. If this kind of arrangements could be made, and the experts could definitely come and teach them, and we should see that the practice is, it continues and sustains by doing a mock drill once in a while, at least once in 6 months. A mock drill has to be conducted. It happens in the villages, some of the villages where the NGOs have done their best. So this is one area we can concentrate. So the pre-disaster, during disaster, after disaster. So risk assessment, mitigation, prevention, that is pre-disaster we have seen. Warning, evacuation, saving people, assessing damage, this is during disaster. And preparing the people, early warning system, capacity building, risk assessments, everything, that is post-disaster.
Work across organizations, sectors, and levels. Effective DRM requires the ability to work across different organizations, sectors, and levels of government. And so we need to give greater consideration to developing skills for integration and collaboration. Building capacity for mainstreaming DRM can be highly effective in bringing about valuable long-term change. It's also important to build DRM capacities at all levels, from national government to communities, including regional and local government levels, which can often be overlooked.
We have seen this underlying factors. For that, all the departments of the government, if it is the DDMA, the line departments, like police, revenue, agriculture, social welfare, education, health, all the departments have to work together with the people to identify the vulnerability by using, for example, Mahatma Gandhi National Rural Minimum Employment Scheme is there. So they can be employed and they can build whatever rescue measure they want to do. So they get benefit, they are getting jobs, as well as they are building resilience for their community. So this is called mainstreaming of disaster risk reduction into. So if you can use the existing schemes of Government of India, state government, into the ongoing developmental projects, the vulnerability could be straight, we can reduce the vulnerability and increase the capacity of the community. So mainstreaming is one of the areas where we can think about one area. Maybe the developmental professionals can sit and analyze each and every scheme of Government of India and explain to the community, which will increase their family revenue by increase their livelihood options. So that is one area we can think about. These are the areas like shelter, water, sanitation, child education, livelihood, environment, public health. Think about it. Now these are some of the examples. Now these self-help group in North Chennai, they have learned how to make fish pickle. Now from another group is now, they are now thinking of making some venture on package industry. So now they want to keep it for 6 months because there is a heavy demand from the cruises, from the ships to keep this fish pickles for 6 months. So now another group is working on planning how to make produce package materials. This side is now, see, these are the mask and glove stitching is one side is going on. They're all well trained. Now, the recent development is there are solar companies have come forward. That now recently Madurai, we have opened a solar powered tailoring unit. So we don't need an electricity as to support. So it is 24 hours, your electricity is there and storage points are there. So now 32 different type of livelihoods have been identified using a solar power. And the women are trained in construction, especially construction of toilets. Women are trained so that in case of a model or a repair or anything, institute is there, the women are always available in the community. And livelihood option, the driving is one of the areas which think only men can do it. Women came forward. So every sector of life, when we increase the capacity, naturally the vulnerability level comes down. And education is concerned, and doing a mock drill. Now this is a mock drill for earthquake. Just drop, cover, hold. And this is a small game introduced by seeds. And based on this, we have another game also was introduced. Now see, in every school, the school map is being kept. So this also could be a venture by Lions Club and Rotary Club, helping the schools to make their own the map and kept it over there, so that every time when the child looks it over there, in case of emergency, immediately it strikes where to go. And in case of tsunami, they had come to the plain road. If it is in the elevated place, and if it is an earthquake, they have to come to the plain. or lightning or thunder. So it's always will be in the minds of the children. And the lab should be well equipped with fire extinguishers and the capacity is increased. Other than that, community level, having toilets or healthcare posts, and then making use of the rainwater harvesting, segregation of solid waste, using the solar panels and then biogas plants. These are some of the developmental aspects that will reduce the vulnerability. And the development should be on the favorable side, not on the vulnerable side. If one person comes and cut down all the trees and constructing the factory, it is not a development. It is on the vulnerable, because it may cause some kind of vulnerability. Again, disaster affects the development. It should be on the favorable place. Two examples quickly. One, this is in Pulikat, that is Ponneri, where the bridge was washed away. And then the lighthouse Kuppam, where the lighthouse is there, it was totally cut off. So it took almost 2 years. Because there is a Sweetwater Lake is there. Pulikat Lake is there. And there is a bird sanctuary is there. So bridge could not be constructed beyond the level. There was an objection. So all the community, so look at this place, it was deserted. But now after the bridge is constructed, now the entire community is now flourishing, and the children are going for higher education, and it's well connected. And now good business is going on, fish business is the biggest business. Whereas here, they have made arrangement for the houses, but the wastewater management is very poor, where the wastewater is spilling out and causing a lot of problems. So this is not the right kind of development. It should be looked into it and it should be rectified.
Carefully plan and design programs for lasting impact. Capacity building programs need to be designed carefully, giving particular thought to how we can sustain all that's been achieved once a program has come to an end. Too often, programs are squeezed into timelines too short to secure their lasting impact. Ensuring that programs have robust monitoring and evaluation systems that focus on outcomes and impact is also important.
It is not only planning, we should have a clear understanding of what is happening and continuous monitoring, and then evaluation of the projects. Again, what are the resources in the village? Now see, these are the resources. This circle is the identification of the village. These are the resources inside the village, outside the village. The sizes will show you how much they are useful. Like a ration shop is there, but if there is no proper distribution, then the circle will be smaller. And the hospital is there, but it's fully functional, then the circle will be bigger. So by looking at it, how much the people having resources and how much they are vulnerable to level with the resources, even if it is available. So you can list it over here and then you can group like this. And then make the children, this is a biodiversity table, where make the children this was introduced in school. This again Lions Club and Rotary Club and think about introducing the schools. We are given a book where the children have to put every day what are the birds they have seen, what are the flowers they have seen, what are the trees they have seen. Now see, in 1960, there are 10 trees. Now every year it has come to now it's only 3 trees are there. So again, the community will take an evaluation of where exactly we are now compared to 30 years back and how much we are losing the natural resources, which is going to have an impact on our disease. So this mapping will definitely help, and we have to teach them, and continuously we have to help them continue. Last.
Pay attention to the context. It is important to pay attention to the local context when planning capacity building activities, so that they are relevant and based on a good understanding of local capacity needs. All programs should be based on thorough capacity needs assessments.
Red Cross have done a wonderful job. They have trained the communities in first aid, and especially women group. Now this lady is making a belt, water belt. So this could be tied around the waist, so that even if a person who doesn't know they're swimming will float and they can be safe. Now this is a small model of a water hand washing unit made out of waste materials. It's all waste materials completely. Now children have been trained and they are the ambassadors, or they are the messengers who will carry the values to the entire community. So every person is very important. It's disaster risk reduction is the business of everyone. It's not only the governance, it is everyone's business. Earlier, we are using all these things, whistles and voicing. Nowadays, we have advanced level of mobiles and messaging is available, group messaging, And Dr. Renuka was clearly talking about WhatsApp groups are playing a major role. Immediately teachers and people are in action. So we can give a best service provided with this well organized and take it further. All
আমি অপু এবং মনোজ এখন বরগুনা জেলার অঙ্কুজান পাড়া গ্রামে, যেখানে আশেপাশের 5টি গ্রামের মানুষকে সাথে নিয়ে একটি ঘূর্ণিঝড় মহড়ার আয়োজন করা হয়েছে, যাতে ভবিষ্যতে ঘূর্ণিঝড় মোকাবেলায় এই মানুষগুলো আরও ভালোভাবে প্রস্তুতি নিতে পারে। 1 থেকে 3 নম্বর সতর্ক সংকেতের সময় একটি পতাকা ওড়ানো হয়। এ সময় ঘূর্ণিঝড় সম্পর্কিত রেডিও বার্তা নিয়মিত শুনতে হবে এবং স্থানীয় স্বেচ্ছাসেবী ও দুর্যোগ ব্যবস্থাপনা কমিটির সাথে যোগাযোগ রাখতে হবে। সালাম ভাই ও তার স্ত্রীকে সাথে নিয়ে আমিও যোগ দিয়েছি এমন একটা উঠান বৈঠকে।
আচ্ছা, আশ্রয় কেন্দ্রে যাওয়ার সময় কি কি সাবধানতা অবলম্বন করতে হবে?
মা এবং বোনদেরকে লক্ষ্য রাখতে হবে, তারা তাদের চুলগুলো বেঁধে যাবে এবং সালোয়ার কামিজ পরে সতর্কভাবে চলে যাবে।
ট্রেনিং থেকে আমরা শিখছি, আমরা যাওয়ার সময় যে 8 নাম্বার সিঙ্গেল দেবে হেই আমরা আশ্রয় কেন্দ্রে চলে যাবো। আমরা শুকনো খাবার টাবার নিয়ে যাবো, ফুল বাইন্ধে যাবো, যেন কোনো গাছে গোছে না পেঁচায়, যেন আমরা মারা না যাই।
মহারাজ শুভ উদ্বোধন ঘোষণা করছি। এখন মহাবিপদ সংকেত অর্থাৎ 8 থেকে 10 নম্বর সিগন্যাল চলছে। গ্রামবাসী সদল বলে সবকিছু নিয়ে এই আশ্রয় কেন্দ্রে চলে আসছে এখানে আশ্রয় নেবার জন্য।
এ ধরনের পরিস্থিতিতে বাড়িতে থাকা গবাদি পশুকে উঁচু ও নিরাপদ কোনো স্থানে নিয়ে যেতে হবে।
স্বেচ্ছাসেবকদের একটি দল আশ্রয় কেন্দ্রে আসার পথে আহত ব্যক্তিদের উদ্ধার করতে এবং অন্য দলটি তাদের সেবা দিতে ব্যস্ত।
সবশেষে আশ্রয় কেন্দ্রে আসা গ্রামবাসীদের মাঝে ত্রাণ বিতরণের মাধ্যমে শেষ হচ্ছে আমাদের ঘূর্ণিঝড় প্রস্তুতির চূড়ান্ত।
From Bangladesh, if Rotary Club and Lions Club can think about the mock drill culture, at least one district, they can start with Kanyakumari, then definitely it will have an impact on the entire state. We can carry it. And the last one.
Number 6, foster ownership. And finally, ensure that those being targeted for capacity building have a clear and significant role in designing and implementing the program. Ownership is built through participation, engaging leaders and winning high-level support, as well as aligning with existing DRM strategies and policies. By carefully implementing these 6 key principles, together we can improve the effectiveness of our efforts to build DRM capacity and increase the resilience of vulnerable communities.
Ownership to the community is the final thing. We can do anything, but unless otherwise the community wants it, the development is always a question. Now, this is what constructed by Tamil Nadu Agricultural University and the local NGOs called Waste and Scope on Ecos on Toilet in Musili. Now, after the community has taken over, when they understood the necessity of the toilet, community toilet, how much it has reduced the diarrheal cases and the improvement of their health. Now the community has owned it. Now see how beautifully they are maintaining, and the health messages are written over here. And new people are using the toilets, are being well informed, and the water is, there is no stagnation, no nothing. It's beautifully maintained. It's one of the best practices we have ever seen in water sanitation. So finally, the emergency systems are well placed. We should train whenever the warning is given, how to respond to the warning according to the hazard. That's what I said, multi-hazard situation. Now see, for example, as Kadalur is concerned, it is cyclone prone, flood prone, earthquake prone, and biological hazards also. So for each one has got a warning. Each warning, it should be something is slow onset, something is quick onset. An earthquake is a quick onset, and a cyclone is a slow onset. So they have time for that, but there is no time for the earthquake. So how far they can do towards it, all depends on the practice and how much we are going to make them or prepare them for the hazard. So this is the phases we are seeing. Each activity is mentioned over here. This is preparedness, recovery time, what is required, prevention, relief, response, and finally rehabilitation. And we can have a complete database of management information system and geography information system connected to the map. I think definitely we can handle, like Dr. Renuka and Lada was talking about, definitely we can handle the situation provided continuously we put our energy and knowledge in training the people. So the 5 things we concentrate: people, prosperity, peace, partnership, and planet. And this SDG 2 is talking about hunger. That's the first thing I talked about. World Health Assembly targets is always hunger, elimination of hunger and poverty. Number 2 is to give a healthy life to everybody, having a good environment. And water sanitation is the one important thing, which is carrier of most of the communicable diseases, which weakens many community people. So these 3 areas we have to concentrate. And some common principle that should be transparency and accountability, to be open to those agencies which believe in neutrality and secular outlook, comply with the humanitarian charters, fair standards, the globally which is being followed, based on collaborative and consultative process, to avoid duplication of resources. Same thing doing again, same community is doing, or same group is doing, it will be a duplication and it will not give the full benefit. And to share and exchange good practices. So these are the 7 areas of focus. You can choose whichever area is comfortable to us according to the requirement. Water sanitation, economic and community development and livelihood promotion, maternal health and child health, supporting the environment, basic education and literacy, disease prevention, and finally peace and conflict in case of a war situation. So development and disaster management should go hand in hand. That's what we call the build back better. If development is going one side and disaster management on the other side, we will never end the discrimination. So we should always consider the development and disaster management. When disaster management also happens, then we take it as an opportunity to build back better, identify which are things which is not required, and separate those things and make the development to go fast. So people, planet, partnership, peace, prosperity to bring. So to know the risk, no risk. If you don't know the risk, there will be always a risk. Through government organization and humanitarian organization coordination, we can promote culture of preparedness. Together, we can build disaster resilient and safer Tamil Nadu. So, by the risk, develop a plan, implement and train, and be a leader in our community. Thank you so much for your attention.
Yeah. Thank you very much, sir. It was indeed a wonderful. Sir, I have now fantastic. I wish you could have a separate session for this. I think I would like to attend. Thank you so much, sir.
Thank you so much.
I am giving vote of thanks on behalf of Suresh Kumar. Thank you, Suresh Kumar.
Please.
Yes.
I take it is a privilege and proud honor that Professor Suresh Mariaselvam sir is instrumental in organizing this webinar series for the last 2 months. He has connectivity worldwide. He has contact with the entire professionals working in disaster management system across the world. He was working with UNDP, UNIDO, UNICEF. He was trained, rather he got his postgraduate degree from UNIDO and public health response system, public health expert he is. He worked in VIT, Vellore and SRM Chennai, and is a person connected with well-versed knowledge of all the core area of disaster management. Of course, I could not introduce him in a better way, but this is the ownership. If at all there is a system failure, Professor Suresh Mariaselvam sir always take ownership and help us, support us. He is the bridge between all the experts and the participants. So thank you very much, sir, for your nice presentation.
My pleasure. My pleasure. Thank you.
The important core area of role of CBO and international humanitarian organization in response to disaster risk reduction program. Thank you very much, sir. Thank you.
Thank you. It's a pleasure. It's a pleasure for me also. It's a pleasure for me also. It's a pleasure for me also to get introduced to high caliber workforces, and looking forward in future how we can work together in bringing down this. Thank you so much.
Thank you, sir.
Now, Dr. Renuka Madam will propose water thanks.
Thank you everyone for attending this wonderful session on International Day for Disaster Risk Reduction. And I'm very happy that I was present here. And in fact, I'm thankful to Suresh Kumar sir for organizing this such a short notice and all the organizations involved, Lions Club International, Rotary Club of Chennai Bharati, and of course, not to miss the Indian Red Cross Society. I always want to become a member of all these organizations. I don't know how I will become a member of everything. So God wish I should become a member of everything, I think. And I'm really thankful to Professor Vinod Chandra Menon, sir, who from founder member of NDMA was here. I'm so surprised, such a small meeting, but then he could come. I'm really thankful to you, sir. Mr. Michael Veda Siromani, IAS retired, sir, former Additional Chief Secretary of Government of Kerala, Thirunananthapuram, also was here. Wonderful speech, sir. All years, I think we could ever keep listening to it again and again, I feel. Thanks to Lion Justin Paul, sir, District Governor, Lions Club, International District 324B4. I am so happy that he is also 5 southern districts of Tamil Nadu he is in charge of. I am really thankful to you, sir. You also gave a very inspiring speech. Dr. James R. Daniel, Chairman, Indian Red Cross Society, Kanyakumari District. I am very attached to you, sir. I don't know why. You and Suresh Mariaselvam, sir, and in fact, I should say Vinod Chandra Menon, sir, as well as Justin, sir. I should shift now, I think. Where, I don't know. But anyway, I will help you in my ways, whatever little way. Or maybe I will be a drop in the ocean. But still, I can help you also in whatever way I can. And thanks to Advocate Swarnalata Mahesh, our President of Rotary Club of Chennai Bharati, and Suresh Mariaselvam, sir, who is in public health effort, and he worked the field of leprosy. I'm really thankful to God for showing you to me now, sir, at least in this meeting, and really thankful to members of all the organizations who are involved and all the people who have come joined this meeting. I'm thankful to each and every one of my friends who are also joined here from Rashtrapati Bhavan, Maran, sir, so many people who are here. I'm really honored to have all of you here. Thank you, one and all. Thank you so much. And God bless us so that we will be in 2021. Again, we will come back to normal. இதுவும் கடந்து போகும் என்ற நிலைமை நமக்கு கண்டிப்பாக வருவோம். நாம் அனைவரும் பிரார்த்திப்போம். நன்றி, வணக்கம்.
Thank you, ma'am. Thank you. You say you are only drops. Polio drops is only 3, but it saves a big life, ma'am. So don't worry. A drop is always big. Thank you so much.
Thank you.
Thank you. Well connected.
I'll take all your numbers from sir.
Please. Thank you so much. Most welcome.